Hello, I'm Dr. Aniketh Venkataram, consultant plastic and aesthetic surgeon at the Venkat Center for Aesthetic Health, Bangalore. If you're someone considering a facelift, it can be quite confusing. There are so many techniques. You have a short scar facelift, you have a deep plane facelift, you have a SMAS tightening facelift, you have an endoscopic facelift. Also other questions. Do you need a blepharoplasty? Do you need a brow lift? Should you do only the face? Should you do the face and the neck? All of this can be overwhelming. Now, let us start by understanding the basics. What is a facelift? In very simple terms, it's a surgery to lift the face. This is done with an incision in front of the face. It goes along the hairline and in front of the ear. We lift up the skin and we tighten the internal tissues. And then after tightening the internal tissues, some extra skin is removed and it is stitched up in this line. So, the scar of the surgery comes within the hairline and in front of the ear, and it is very, very hard to make out. A neck lift is when this scar runs behind the ear into the hairline, and through that we reach the neck, and we do a similar thing in the neck. We tighten the tissues inside the neck and lift up the skin. So, usually a full facelift refers to a facelift and a neck lift, wherein there is a scar in front of the ear and behind the ear. You are tightening the lower face and you are tightening the neck. So, a facelift is good for the lower 2/3 of the face, a neck lift is good for the neck. Now, within this, there are various techniques of facelift. Remember, I said we tighten the tissues inside. There are various different methods in which those tissues can be tightened, and that is what leads to different techniques of facelift. You can have something called a SMAS facelift, wherein you're just putting a few simple sutures. You can have something called a max lift, wherein you're making a hole in the deep fascia and you're tightening tissues with a long suture. Or you can have something called a deep plane facelift, wherein apart from lifting up the skin, you're lifting up the next layer also and creating what is called a deep plane. So, you're creating a second layer of dissection and lifting up the internal tissues and tightening up the internal tissues. So, which one of these techniques is the best? Well, there is no simple answer to this. Each one of them have their pros and cons. For some patients, a simple facelift is better. For some patients, a deep plane facelift is better. It's not like there is one size fits all. So, if a surgeon knows multiple techniques, he can choose and decide which technique is better for you. Now, the other question is something called an endoscopic facelift. This is where tiny holes are made inside the hairline, and through tiny tunnels, the internal tissues are tightened. This is typically good for people whose aging isn't very advanced, whose face is not very, very saggy. Now, the next question is, doctor, what about non-surgical treatments? So many people promise skin tightening with non-surgical methods. Can that be used to avoid a facelift, avoid this surgery and scar and everything? Well, it works for early changes. When the facial sagging isn't very severe, when the face is not falling down too much, typically in your 30s and 40s, then these non-surgical treatments are good. But as the face ages more, you start getting these lines and the heaviness over here. That's when non-surgical treatments don't work as well, and that's when you need surgical treatments. Remember, non-surgical treatments are advantageous that there is no surgery, but there's also a limit to how much they can do. Surgical procedures, they are more invasive, there is more recovery time, but they also give you a bigger result. So, when someone needs a surgical procedure, trying to do a non-surgical procedure simply won't cut it, and it's just going to be a waste of your money. So, how is the facelift itself done? Typically, this is done under general anesthesia, although if it's a short scar mini facelift, that can be done under local anesthesia as well. You're usually admitted in the hospital for one night and you go home the next day. As I said, there will be some tiny stitches running in front of the ear and behind the ear. You feel pretty okay within 1 or 2 days. You can work from home, work on a laptop within a couple of days. The stitches are removed after 1 week. For you to go back to work and people not to know that you have done this surgery, that usually takes around 2 weeks. You can start exercising after 3 weeks and you're pretty much back to normal within 6 weeks. Now, doctor, what about other procedures? People say a brow lift and a blepharoplasty, is that also needed? Well, again, this depends on the patient, but in many times it might be needed. As I said, a facelift works on the middle and lower third of the face. The upper third of the face, that is not a facelift. So, what is that? So, to lift up the eyebrows, that is called a brow lift. We make tiny cuts inside the hairline, we lift up the eyebrows and then we stitch it in place. To improve the eyes, that is called a blepharoplasty. So, when there is a lot of loose skin in the eyes are kind of falling down. To tighten that and make that look better, that is where we do a blepharoplasty. And the last thing that can be added to this is called fat transfer. So, usually when the face is little empty and there is a hollowness over here, that is when we take some fat from the stomach and we inject that over here at the same time. And this can also be done at the procedure. So, all of these procedures can be done together. So, doctor, what should I get done? You told me so many topics. Well, again, it depends on your individual requirements. Not everyone needs everything. Some people just want to do the eyes, we just do a blepharoplasty. Some people have, their neck is quite good, or there is only a little bit of facial sagging, we just do a short scar facelift. Some people are very advanced, the entire face is sagging, they look very old. There we go all out and do everything. Brow, eyes, facelift and neck lift. So there is no unique answer to this. There is no one size fits all. And your surgeon should know that. He needs to analyze you and guide you on what is best for your requirements. So I hope this video was useful for you in terms of understanding the various complicated terms within a facelift. When done well, it is a transformative procedure. It can make you look 20 years younger. The key word being when done well. The best facelifts are the ones that no one knows about. Many celebrities who you think are looking so natural, they have actually had facelifts done well. You might be scared of this procedure thinking it makes you look weird or unnatural. Those do exist because it has not been done well, but that represents the tip of the iceberg. That is like maybe 5 to 10% of all the facelifts that are being done. The other 90% of good work, you don't even realize that the person has had a facelift done.